Research methods, design and strategies in the field of marriage and family therapy. This is Maria Lawton from North Central University. First, I want to talk about the importance of research to the field of marriage and family therapy. Marriage and family therapy as a field and as a practice has not been around as long as many of the traditional forms of psychotherapy, psychology, psychiatry, even social work or clinical counseling. And doing research enables us to provide evidence and to show effectiveness in our approaches. Our approaches are not as traditional and as far as systemic theory, and we need research in order to promote our field and to show how much we're able to bring about positive change and resolution for our clients. Another important factor of research is that it allows therapists to keep their skills sharpened, learn about new techniques, and remain relevant and competitive in the field. And it's so important for therapists to continuously learn about new techniques, new strategies, new interventions that are made available to help better our clients' situations and bring about quicker resolution. And you can only do that by continuously learning and researching and making sure that you're up to date on all the latest. And the last factor I want to mention is how important research is in terms of third-party reimbursement. Insurance companies don't know a lot about marriage and family therapy, and providing them research and basically proof will help validate our treatment options, help insurance companies gain trust in us. So this is something that's critical, particularly to help those clients who can't afford to pay for, private sessions, that they are going to rely on third-party reimbursement, particularly families will rely on third-party reimbursement. So we need to be able to show that what we do is effective, and that's only going to be done through research. Okay, now I would like to just do a basic overview of the research process in general. And it starts by having a clear idea about what you want to observe. What are we searching for? What do you want to find out? What is the how and the why? And it's more than just a basic question. It is about determining a subject that you find to be necessary as far as exploring in order to find out more information and learning the ins and outs and the hows and the whys of what we're looking for and what we're trying to observe. And after we have a clear idea about what we want to observe and find out, then we have to determine the best way to do it. How are we going to start tackling this project? Is this particular question going to be best answered by using a quantitative approach or qualitative approach? And then lastly, we need to discover the purpose of our research. Are we simply just trying to explore a topic? Do we want to be able to describe a phenomenon or maybe just describe a particular issue in greater detail? Or are we looking for explanations? What are our desired outcomes? And this is important in just the basic structure of research. In continuing in the overview of the research process, I'd like to talk about conceptualization and how important it is to also apply conceptualization to your research study. In other words, as you continue on planning your research, what ideas and concepts have you laid out for the foundation of your research and that will lead you to specific results? And this will help attribute meaning to your research and also help provide more meaning in your results. When you conceptualize, you're actually providing ideas and concepts that will serve a purpose for the research. Another factor is deciding what group of subjects you're going to be studying and observing, and this is also referred to as sampling. Are you going to be looking at physical characteristics of a particular group or an individual? Are you going to be looking at characteristics that will only be measured by answering a questionnaire or having a group discussion? And then lastly, you need to interpret and analyze the data that you collect in order to attribute the meanings to them. What conclusions, theories, and ideas are you going to develop from doing the two previous steps? And this is an important part of our research. Now I'd like to talk about the differences between quantitative and qualitative data collection methods. Quantitative data collection methods are much more structured. They will use an instrument with a predetermined category. Often, one of the ways to measure in quantitative research would be by using a questionnaire in which the answers are predetermined. They have predetermined categories. Let's say strongly agree, agree, disagree, and strongly disagree. So they're set and they're assigned codes for each category. Oftentimes random sampling will be done to test a hypothesis, and then we'll use the results to come up with statistical information. For example, let's say somebody wants to test the general age group of those who find themselves in the emergency room after 10 p.m. It's a very specific, structured way of researching. The researcher could go into a hospital emergency room and simply collect data based on the number of patients and age of the patients that are generally in the emergency room after 10 p.m. So it's done in a very structured, predetermined sort of way. Quantitative research will also use surveys, typically questionnaires, and in the event that they use interviews, it will be generally closed-ended questions, questions that will elicit a brief yes or no response. On the other hand, qualitative data collection methods are much less structured. There's not as many set protocols, and it is more focused on just observing behavioral patterns. Because of that, because it is less structured, it is often much more time consuming. The researcher has the ability to use various ways of not only observing but also recording the information. And for the most part, qualitative research will involve in-depth interviews, open-ended questions, and observation methods. And open-ended questions that generally will get a discussion going, explain this situation, or give examples of how you experienced this. Much less structured and much more in-depth. I'd like to talk about some factors to consider in doing quantitative research and analysis. The first point I would like to make is it is important to consider how the information is quantified. What type of scores are assigned to each category and response? How reliable and valid is it? In other words, are you actually measuring what you're intending to measure? And are the means that you're going about to do it reliable? Are the codes that you have assigned to each category or response valid, logical, and reliable? Another factor to consider is what computer program will you be using to interpret your data? Most of them are going to be handled by computer programs that must be able to read the data that you've collected and interpret it in a consistent way. How will that data be converted to be read by the system or the program? Are the variables that you're measuring that simple to be converted? Or are they basic in terms of gender, eliciting a very basic response, or something that is a little bit more complex that may involve the researcher actually doing their own type of coding? And then lastly, what patterns are discovered from this type of research? What type of frequency distribution do you find in terms of which variables are showing up more in the samples as having an effect on whatever you're trying to observe? For example, if you're researching alcoholism and one of the variables is gender, how many times are you seeing a percentage of males showing up as having alcoholism or females? What percentage do you see the variable showing up? Now I'd like to talk about factors to consider in qualitative research and analysis. This was one of my favorite quotes that I found in our text, The Practice of Social Research. But qualitative research is about making sense of social observations as data collection, analysis, and theory are intimately intertwined. One of the things that you have to consider is that reliability can be impacted. Since this type of research is so personal and so in-depth, it's going to be subject to how the researcher is going to perceive the information and observe the information. That can sway results drastically. So reliability can be a concern in terms of qualitative research. Because qualitative research is also so involved in terms of the researcher being involved in the subjects, the role of the researcher is extremely important. Is this researcher able to relate to the subject? How are they asking the questions? Is the way that they're asking the questions going to affect the outcomes of the answers? So the role of the observer researcher is so critical, and how they handle themselves can really affect the results of the research. I'd now like to review some of the paradigms in qualitative research analysis. First, we have grounded theory. Grounded theory begins by first observing rather than forming some type of hypothesis and then seeking to test it. So it's going to collect data first, does not have any preconceived ideas, and just simply looks for patterns in the observations. Then we have case study. And basically, case studies will look closely into one particular case. And this would generally be a specific group of people, race, family, specific city or region, and basically looking for information on this particular family, group of people, or looking to explore further to gain more insight on a particular group of people. And then one of the last ones I chose to talk about was participatory action research. And this type of research will have the actual subjects involved and have control over the actual research process. And I guess the rationale there is this particular group of people is going to be impacted by what we're studying. In my example, I have alcoholics. I had studied alcoholism throughout this course. And participatory action research would actually have the addicts involved in the research process. They're experiencing it. They have insight on it in a way that researchers don't, given that it's impacting them the most. And so they have involvement. Now I'd like to talk a little bit about sampling. The first type of sampling is called non-probability sampling. And in this type of sampling, the research subjects are specifically chosen. And there's a few different types of non-probability sampling, one being purposive, or also called judgmental sampling. And this is where the researcher will intentionally select a group of people either based on certain characteristics of the group or based on another reason that the researcher feels will help the study. Then we also have what's called snowball sampling, and this is where we take the existing subjects that we've got in our research and simply ask them to refer anyone that they know that may be able to contribute to the study. So you're sort of snowballing the amount of people that you're adding in your study. And the last one, which we just talked about, was case study, where you're actually sampling a specific group of people, family, village, so on and so forth. Then we've got simple random sampling. And in this case, the research subjects are chosen entirely randomly and entirely by chance. And I guess the main premise of this, or principle, is probability. And the probability states that in this type of sampling, all subjects have the same likelihood of being chosen. So it's completely random. And the last one is referred to as systemic sampling. In this case, it is involving when research subjects are systematically chosen. And as Babby has stated for us, it is every kth unit in a list that is selected by dividing the size of the population by the desired sample size. So for example, let's say in my researching alcoholism that I took all of the members of the Alcoholics Anonymous group and systematically selected every 10th member that was listed in the group. And that's basically what systemic sampling does, where it will choose the subjects based on some type of systematic way of doing it. Now I'd like to talk a little bit more about my actual experience in researching alcoholism. And what I needed to start with was I needed to design my research topic. I needed to think about what did I want to learn from the start of the research. And I had decided that I wanted to explore what factors contribute most to the causes of alcoholism. Are they social? Are they genetic? Are they relating to some type of life experience that the addict is going through? And then also, what treatment options tend to be more successful in terms of recovery? So that's where I had to start of what is my how and why? What am I looking for? What information am I trying to gather at the end of all of this? And then second, I had to determine which method of data collection I was going to use. And I wound up using both quantitative and qualitative. In terms of my quantitative research method, I decided to use surveys and questionnaires. And basically, one of the questionnaires would be set up in a semantic differential way, where there'd be a list of questions for the subjects to answer. For example, do you feel that alcoholism can be attributed to a genetic history within your family? Do you agree, disagree, strongly disagree, so on and so forth? And then as far as my sampling in my research, I used purposive, where my subjects were chosen based on the fact that they either would attend Alcoholics Anonymous meetings or had been receiving treatment at substance abuse centers. I also thought it might be a good idea, birds of a feather flock, and many addicts know other addicts, to use snowball sampling to refer others. You know, generally, this isn't something that people announce as being an issue, and it is a personal struggle. But usually those that are struggling will rely on others who are also struggling to help get them through it. So snowball sampling may be a really good technique to use in this type of research. And then after collecting all of that information, I would then analyze the data and would use the results of the surveys and the questionnaires to construct a scale. And then I would be able to assign scores to the patterns of responses that I have. So this would help me find out which factors, based on the answers of the questionnaires, which factors did they feel were most contributing to the alcoholism, and along with what treatment options do they feel is most helpful. Then I'd also be able to use Gutman scaling. This will help me uncover how extreme the indicators are in terms of how many respondents strongly agree or disagree to the conditions of the alcoholism and its causes. So if I have, you know, a high percentage, let's say 75%, strongly agree that one of the biggest contributing factors is genetic history, then that will help me know as far as indicating which factors are most affecting the study. And then I would be using a multivariate analysis to determine the relationships of all the various variables that I would have. So it would be gender, life experiences, communication skills, insecurities, and I would be able to take these variables and then measure which ones have the most cause and effect on the actual condition. Now I'd like to continue on with more examples in my research of alcoholism. I would also include qualitative data methods, and I would be conducting interviews, in-depth interviews and focus groups to be able to get the addict's perception on how alcoholism has affected them, what are the contributing factors, what treatment options do they feel are most effective, and be able to get their attitude and their beliefs on alcoholism. And I believe that can only be done with open-ended questions and very open discussions. I would also initiate a participatory action research study. I would love to be able to get the addicts to design and get their input in the procedures and the basis of the study. They're the ones living through the problem. They're the ones experiencing it and are most impacted by it. And I believe that their input would be extremely valuable. And they may be able to shed some light on certain factors that I may never consider. And then I think it's important to remember that, in terms of being a part of a focus group or in-depth interview, that the researcher makes it very clear that they're going to be observing, they're going to be participating as much as possible, but making it known to the group why they're there and what their objectives are, making them clear. By no means, trying to hide anything or, act even superior or authoritative in any way, that they're just simply observing in hopes of gaining more clarity and information on the subject in general. There are quite a few ethical considerations to keep in mind when doing a research study, and there are several I'd like to review. First and foremost, the subjects that are participating, they must be willing to do so. They must be voluntary. They must not be coerced in any way or pressured in any way. They also must not be harmed as a result of the research. So the style, manner, and intentions of the research must not compromise the safety and well-being of the subjects involved. We also have to make sure that their privacy is protected and that we keep the information confidential. This would also be able to happen by just making sure that the subjects remain anonymous. Also, prior to, the subject should be given informed consent and make sure that they are fully aware of all that is involved in the research, intentions, process, and any consequences that they may face as a result of the research. It is so important to be honest. The researcher must not deceive the subjects or even attempt to justify being dishonest for the sake of the research or for the sake of the experiment. Must maintain integrity and be forthcoming in the intentions of the research. More ethical considerations. One, in qualitative research, the observer really needs to be mindful of his or her own bias, since the research is subject to such personal interpretation. We all have our own experiences, our own perceptions of the world based on our own experiences, and we need to be mindful of that and have a level of self-awareness that we know we've probably got some bias that we need to be mindful of. It's also important for the researcher to be very aware of the lengths that he or she will go to in hopes of getting useful information for the study. One of the examples is, pretending to befriend a subject in order to get more information and in order to get the subject to open up more. And that is something that we need to be mindful of and kind of question the ethics behind that. And lastly, I want to talk about how important evidence-based practice is. And basically, it is our way as therapists of using the research that we have available to us to assist us in making the best decisions for clients. We must utilize, existing data that we have on a subject to be able to evaluate the effectiveness of treatment decisions and knowing what works and what doesn't work. And I think it's our duty as therapists to do our due diligence prior to making any recommendations to clients as far as treatment is researching, and looking at the history of certain subjects in certain cases. Evidence-based practice also needs to consider the client's specific needs. Every person is different, every situation is different, and they need to consider personality characteristics and take that into mind in making decisions on which treatment options they feel will be most successful based on that personal individual. An evidence-based practice, basically, it takes scientific evidence that we have and we'll combine that with the therapist's clinical expertise and experience to be able to provide the most quality care to clients. So it is so important. It is, I believe, part of our duty, that it is not a choice. It's a requirement, and it's a promise that you make to clients that you're going to do the best possible job for them in terms of helping them reach resolution and contentment, whether it be in their relationships or with whatever they may be facing as far as challenges goes. So important to look at past cases, do our research, look at what's worked and what hasn't, and be mindful of that when it comes to making decisions about the treatment for our clients.